everyone, and welcome to Clinical Pharmacology and Drug Therapy YouTube channel. Today we are going to speak about sulfamethoxazole trimethoprim and the combination of these two medication in the brand name called cotrimoxazole and another name Bactrim. We are going to speak about using these medication in a clinical practice. I am Dr. Khalid Hassan, a professor of clinical pharmacology and drug therapy. Okay, so our topic for today, we are going to focus on two main medications, sulfonamide and the other medication, trimethoprim. Sulfonamide, the medication available for the practice for the combination with trimethoprim called sulfamethoxazole. Uh, if we look on this, the synthesis and production of folic acid in the bacteria. This is a pathway for synthesis and production of folic acid in the bacteria. So the bacteria, different from the human cells, by using the material to synthesize folic acid. On the other hand, a human body use the folic acid in diet and in food already. So we don't synthesize folic acid in our system. So this is the differences between the bacterial and the human cells. The human cells are not able to synthesize folic acid, and they need this folic acid to come like substance or like nutrients from outside sources with the food. But the bacteria synthesize folic acid from the precursors, folic acid, tetrahydrofolic acid. Then they will use this tetrahydrofolic acid, as you can see here, for the protein synthesis such as thymidine, thymidine, purine, and amino acid synthesis. During this pathway, as you can see it here, start from pyridine precursor and para-aminobenzoic acid. During this pathway, the bacteria use enzyme to synthesize folic acid, then move to the next step by synthesize tetrahydrofolic acid, which is responsible for the amino acid synthesis. The first enzyme responsible for the formation of folic acid called dihydropyruvate synthetase, and you can see the mechanism of action, how the sulfonamide work. Sulfonamide inhibit dihydropyruvate synthetase. Okay, this is the first step. Then folic acid will convert to the tetrahydrofolic acid under the effect of another enzyme called dihydrofolate reductase. And this enzyme, dihydrofolate reductase, inhibited by trimethoprim. So you can see here this medication, sulfonamide, inhibit the first step of the folic acid synthesis. Trimethoprim inhibit the second step of tetrahydrofolic acid synthesis. Okay, the question here about sulfonamide and trimethoprim. Is sulfonamide bacteriostatic or bactericidal? Is trimethoprim bacteriostatic or bactericidal? We look on the combination treatment between both of them, sulfamethoxazole and trimethoprim, the brand name Bactrim. Is this medication bactericidal or bacteriostatic? As you can see here, they demonstrate that sulfonamide alone considered like bacteriostatic, trimethoprim alone considered like bacteriostatic, which mean these medication, when they use this medication alone as monotherapy, this medication inhibit bacterial growth. So this one considered like bacteriostatic, unable to kill the bacteria. This medication inhibit bacterial growth. On the other hand, when you use the combination between sulfa and trimethoprim together in one pharmaceutical tablet or capsule or injection, such as Bactrim, when you use this combination, this is synergistic effect. So when you use this with maybe two medication in one pharmaceutical form, this will lead to the increased activity of antibacterial. The medication become bactericidal. So bactericidal with the combination treatment, number one, this is advantage. Another advantage, this will lead to the decreased bacterial resistance. So with this combination, this will lead to the two main results. Number one, decrease resistance to the bacterial resistance toward the medication, and the number two, the bacteria become the antibiotic become more potent and able to kill the bacteria. So this medication, when you use it as a combination, and this considered like bactericidal. Moving to the permethamine, permethamine inhibit dehydrofolate reductase. Permethamine is like similar to the trimethoprim in the mechanism of action. Both of them inhibit dehydrofolate reductase. Permethamine, we use it in combination with the sulfonamide for the treatment of toxoplasmosis and malaria with the brand name Fansidar. So in this case here you can see we have three type of medication belong to the antibiotics that inhibit folate, sulfonamide, trimethoprim, and permethamine. Okay, this slide here present the side effect of folate inhibitor in general. As you can see, the first one, crystalluria, that will lead to the precipitate of sulfonamide in the kidneys and cause nephrotoxicity. To prevent this from occurring, we recommend patient to take adequate amount of fluid, hydration, alkalinization of the urine to prevent precipitation. This is number one, crystalluria. This could lead to the kidney stone. Number two, we have hypersensitivity. Sulfa drugs considered one of the most important antibiotic cause allergy. With the allergy, we have around 3% of population may suffer from, or about 3% of population may suffer from allergic reaction. Uh, as a rash or like skin rash, urticaria, and we have very rare and life-threatening side effect called Steven Johnson syndrome, like coming like 1 in 10,000 or like maybe more. It's very rare, but it's very life-threatening infection. Uh, Sulfonamide also may cause hemolytic anemia in patients with a G6PD deficiency. Sulfonamide may cause granulocytopenia and thrombocytopenia. And this, if you look on this one here, we can come to our mind, this medication may inhibit the bone marrow cells. Another important side effect associated with the happened with the children and infant or baby newborn less than 2 months old, 2 months of age, kernicterus. Kernicterus related to the uh, increased bilirubin level in the brain. Or what happened there? We have the protein. This protein here, we have protein, and when we have the bilirubin binding to the protein. So this is the normal things in the blood. So we have protein and we have bilirubin binding to the protein in the neonate and newborn. Uh, when you prescribe when you prescribe sulfonamide when you prescribe sulfonamide to the patient, okay, when you prescribe sulfonamide to the patient, let me select another color here. Okay, when you prescribe sulfonamide to the patient here, for example, if this sulfonamide, the sulfonamide will come here and remove the bilirubin from the binding. Okay, we'll remove the bilirubin from the binding. In this case, we are going to have a large amount of free bilirubin in the blood. Okay, so in this case, the a large amount of bilirubin of the blood, the bilirubin will pass freely to the central nervous system, and we know that the babies has underdeveloped blood-brain barrier, and this may cause permanent damage to the brain and mental retardation sometimes. So it's very important to maybe recommend the patient or educate the patient not to use this medication in patient less than 2 months of age. For this reason, we don't recommend to use Bactrim during pregnancy. Okay, due to the high binding protein, we have sulfa medication. Sulfa medication bind to the protein, high binding to the protein. Okay, with the high binding to protein, this will lead to the competition with other medication binding to the protein, such as tolbutamide. This medication used for as hypoglycemic agent for type 2 diabetes, or when the patient take warfarin and the patient come to the clinic suffer from urinary tract infection and you prescribe sulfonamide, there is a risk of interaction between the sulfonamide and warfarin. So what happened here? If the patient take anti-diabetic medication such as tolbutamide, the sulfa medication will displace the tolbutamide from the binding site, become free medication, tolbutamide, and this free medication increase the percentage of free medication in the blood and potentiate the effect. The result will be hypoglycemic effect. So according to the drug-drug interaction between tolbutamide and sulfa will be displace of tolbutamide from the protein, more tolbutamide, more free tolbutamide in the blood, and this will lead to the hypoglycemic effect. On the other hand, for example, if the patient, for example, already taken warfarin for the deep vein thrombosis or for stroke or for other coagulant abnormalities, and the patient come to the clinic suffer from urinary tract infection, and you are about to prescribe sulfonamide to your patient, the question here, what is the interaction between sulfa drugs and warfarin? So the sulfa drug will displace warfarin from binding protein, and this will potentiate the effect of warfarin and lead to the possibility of bleeding.
When you have patient already treated with the warfarin due to the coagulation abnormalities and the patient on warfarin, the patient come to the medical health center or to the clinic suffer from urinary tract infection, and you are about to prescribe sulfonamide for urinary tract infections. So what is the possibility of a drug-drug interaction between the warfarin and sulfonamide? So what we have here, we have this is a protein here, or like bilirubin, and 90% of warfarin will be bind to the protein. So 90% of the warfarin binding to the protein, and we have only 10% will be free, and this will be active, and this will work and maybe affect the blood and allow the blood to become like thin and does not coagulate. So the patient now come to the clinic, and this patient suffer, as you stated that there, the patient suffer from urinary tract infection, and you are about to prescribe sulfonamide, and this is a sulfonamide here, sulfonamide molecules, and the sulfonamide will bind to the same protein, bind to the same protein here, and prevent, displace, remove the sulfa from the protein. In this case, the free will be switched from 10% to become like 20% or like 30% free, and this will lead to the risk of bleeding. So the free medication will be active medication and will lead to the risk of bleeding. Slide is you consider like one of the most important slide about the Bactrim or like cotrimoxazole combination treatment between the two medication, trimethoprim, sulfamethoxazole, brand name Bactrim, another name cotrimoxazole. Antibacterial spectrum here, they said this medication cover the gram-positive microorganism, and especially talk about streptococcus pneumonia, followed by gram aerobic gram negative microorganism. So the bacteria will be covered. Number one should be aerobic bacteria. We have few positives such as streptococcus pneumonia, but we have less of gram negative microorganisms such as E. coli, Klebsiella, Enterobacter, Haemophilus influenza, Proteus, Shigella, Shigellosis, Pneumocystis pneumonia, may cause maybe pneumocystis, Europhyci, another maybe bacteria that happened during the in patients suffer from HIV. Okay. This group of medication, for example, E. coli, Klebsiella, Enterobacter, this type of bacteria responsible for urinary tract infection, Streptococcus responsible for the respiratory infection. For example, for this reason, we use cotrimoxazole for respiratory infection, urinary tract infection, and some pneumocystis pneumonia. Okay, how this medication work? We have it on the slide. When we have this two medication, trimethoprim and sulfamethoxazole, this combination of treatment presents synergistic effect. So please remember, when you have two medication, this combination present synergistic effect between trimethoprim and sulfamethoxazole. And the reason why synergistic effect, because this combination block two sequential step in the synthesis of tetrahydrofolic acid. Okay, the combination between two medication inhibit two steps of the tetrahydrofolic acid. This is synergistic effect, enhance the activity, enhance the antibacterial activity, and decrease risk of resistance towards the antibiotic. Okay, this slide presents the clinical uses, indication, and the clinical use of Bactrim or trimethoprim, sulfamethoxazole, cotrimoxazole. Number one, urinary, as you can see here, number one, urinary tract infection. Number two, we have respiratory tract infection. Number three, we have shigellosis. We can use it for treatment of salmonella if the bacteria resist ampicillin or chloramphenicol, for example. We can use it for pneumocystis pneumonia. We can use it for traveler diarrhea, according to caused by E. coli, and this reminds us with another antibiotic called ciprofloxacin. It's already covered with the fluoroquinolones and considered one of the most important medication for traveler diarrhea. Speaking about respiratory tract infection, that we have two type of medication, two type of medical case. We have acute otitis media, then we have acute bronchitis. Normally, it's caused by streptococcus pneumonia or Haemophilus influenza. And if you go to the antibacterial spectrum, you can see there Bactrim cover this type of bacteria. Therefore, we use Bactrim for acute otitis media, acute bronchitis in the clinical practice. For the side effect, adverse drug reactions for this combination, number one will be dermatology, could be skin rash, could be Steven Johnson, and it's very common to have it like skin rash, but Steven Johnson is like very rare but life-threatening. We discussed it already in the beginning. Some patients may suffer from nausea, vomiting, and stomatitis. Very important issue here, you can see it: megaloblastic anemia, leukopenia, thrombocytopenia, hemolytic anemia, especially if the patients are from G6PD deficiency. Here, when we talk about megaloblastic anemia, we know that megaloblastic anemia is due to the deficiency of decrease of folic acid in the human body. So you can see it, I will repeat it here. For hematologic effect, we have megaloblastic anemia, leukopenia, thrombocytopenia, and then we have hemolytic anemia. So we have two type of anemia. Number one, megaloblastic anemia due to the deficiency of folic acid. And number two, we have hemolytic anemia due to the deficiency of G6PD. This will conclude our session for for clinical pharmacology and our topic about antibiotic. We discussed the sulfonamide, how the sulfonamide work. We discussed the combination between sulfonamide and sulfamethoxazole. We discussed the bacteriostatic bactericidal concept. Also, we discussed what type of sulfonamide, trimethoprim, and permethamine do you have, adverse effect, crystalluria, hypersensitivity, Steven-Johnson syndrome. We discuss hemobiotic disturbances. We have for example, two different type of anemia. We discussed the kernicterus. For this reason, we don't recommend to use sulfa drugs in young children, neonates, and newborn children. We discussed the drug interactions, especially with the diabetic medication, with the warfarin. We discussed also the broad spectrum of Bactrim, the clinical use of Bactrim also. So we conclude our lecture by talking about the side effect of Bactrim or cotrimoxazole, this combination of treatment. We focus on the anemia, two type of anemia. We have megaloblastic anemia due to the deficiency of folic acid, or hemolytic anemia due to the inpatient maybe or suffer from G6PD deficiency. This will conclude our session for today. Thank you so much for your watching, and have a great day, everyone.